Well, Lisa, thank you so much for some of your time today. I really appreciate it, especially for this conversation on the Black maternal health crisis. It's so important. And I think we're just sort of starting to see some of our media beginning to cover it. Definitely should have been covering it a long time ago, though. And so I just wanted to start off by asking you, when did the maternal health crisis, particularly for Black women, come to your knowledge? When did you become aware that this was something that was happening to Black women?
I will start off by saying that I am the president of the Equal Justice Society, and we are a national public law firm. Our mission is to transform the nation's consciousness on race through law, social science, and the arts. And prior to being the president of the Equal Justice Society, I worked as a civil rights attorney, focusing in on employment discrimination, healthcare discrimination, international human rights law, and police misconduct. So, given the nature of my work, especially the critical reliance on social science in terms of the cases that I brought when I was in private practice and in the litigation and advocacy work that we do at EJS, we really do center social science. And so, given that we work with researchers, we make sure that we are apprised of the most salient and innovative research as it contains to social justice and racial justice. So I've been aware of these statistics for many years. I also have personal anecdotal experience based on my own lived experience that makes me aware that, frankly, just as the American Medical Association declared in 2021, there is a Black women's health crisis, where in our healthcare system, Black women are persona non grata and really, frankly, quite in danger in our healthcare system because of stereotypes about Black women, because of explicit and implicit biases that really actually emanate from stereotypes about Black women and their value in our society that began during slavery, were replicated during the Jim Crow segregation era, and continue in the post-civil rights era, and lead to the abominable statistic on Black women's health that we see today.
You mentioned that you have personal experience with are you willing to share what you went through?
I think these things are very, very difficult to share. And I don't want, I come into this as a subject matter expert, so I don't necessarily want my personal experience to overshadow my subject matter expertise. But I will tell you that I do think it's important to share. And I always tell my clients that the only way that we can change these social injustices is if we share, because the human experience is actually what resonates with people, and really will bring people to the table in a more honest and authentic and candid way. So I will take my own advice and share my own personal experience. During my first pregnancy, my first experience becoming a mother, I carried my child for 9 months. And very, very late in the pregnancy, shortly before my due date, I let my doctors know that there were problems and that it did not feel right. I was dismissed as a first-time young mother and completely ignored. The protocols that were supposed to be triggered by the statements that I was making about what was happening at this late stage of pregnancy were not triggered. And my child ended up dying during the childbirth. So I do attribute that to, frankly, to racism and to the fact that I wasn't really seen as a person of value within the healthcare system, and as such, the worst thing imaginable happened, something that changed the entire trajectory of my life. And these injustices, they're not light injustices. They are life-changing, abominable injustices that we are talking about. That's my personal experience. My personal experience is replicated thousands and thousands of times over and over again. We know that Black women and child birthing Black mothers are 3 times more likely to die than their white counterparts, and that is irrespective of socioeconomic status. So you can be an African-American woman with a PhD versus a white woman who hasn't even graduated from high school, and you are 3 times more likely to die during pregnancy or from a childbirth-related death as a Black woman with a PhD than a white woman with no degrees at all. So this is not, you can dismiss it and say, oh, that's because Black people are poor, they don't take care of themselves, or they're not educated. But the fact that this is across socioeconomic, across the socioeconomic hierarchy tells you that this is very much about race and the hostility toward Black femininity and Black womanhood within our healthcare system.
Lisa, thank you so much for sharing. And I don't want to linger on your pain or anything like that.
No, please don't. Let's.
But when you talk about the injustices, and I'm curious if you see this as social injustice, or is this a political injustice? Is this something that's our culture, or is this something that's coming from just the way that our healthcare system is set up in America? Like, where do we, I don't want to say place blame, but where does the blame in this case go? Our culture or our politics?
Everything is culture and politics. Many of our systems are socio-political systems. And I sort of see this very much from an anthropological perspective. This is really about culture, but it is there's an intersectionality between economics, politics, and society, right? So it really is a constellation of factors, and it's across systems. Statistics and data, that's my truth, right? Because people can say, oh, that's just your imagination, or that's just your perception, but facts are facts, and the numbers don't lie. And we know that in a city like San Francisco, the infant mortality rate for African-American infants is 6 times that of infants of any other race. We know that that African-American newborn babies across America are 3 times more likely to die if they are delivered by a white doctor. We do not see the converse when white newborns are delivered by BIPOC doctors. Doctors are heroes. We saw that during COVID, but the fact is that they are also human. And racism is something that courses through the lifeblood of this nation, and implicit bias is always present. And so we do have a major problem of implicit bias in our healthcare system that drives these abominable statistics.
One thing when we see, for instance, from the CDC, that I think it's like 85% of maternal deaths are preventable. When we look at these numbers of Black women being 3 to 4 times more likely, or Black birthing people being 3 to 4 times more likely to die from pregnancy-related causes, and then you point out racism is something that's human, right? We're not born racist. It's something that we acquire through whatever situations and environment and raising and all of that stuff. So looking at your work, and particularly with the Equal Justice Society's mission, is the conversation that needs to happen then with current doctors, or do we have to start younger? Like, where do we start to address the fact that this racism is not only systemic, but something they're bringing into their profession?
Yeah, that is right. That's the question. That's the rub. So, we're dealing with systemic and institutional biases, right? But we are also dealing with a narrative about an anti-Black narrative that has been in existence for hundreds of years, that is a driver of, that continues to be a driver of both implicit and explicit bias, right? So this notion that Black people are worth less is something that is very much embedded in the way that we think, because that's just a message that we're constantly getting through every interaction that we have within our culture, from the time that we're born to the time that we die, right? And so that is why implicit bias is so prevalent and has such an impact on our day-to-day decision making, especially rapid fire decision making, where you don't have a lot of time to assess your biases, and they are getting triggered because of stress. So we have to make both systemic changes, and we also have to be the change that we want to see, right? We have to change ourselves in the way that we think, and we have to do a lot of work about shifting the narrative on Blackness, right? Shifting the narrative on Black femininity. The narrative that we have been dealing with, the status quo narrative, what Toni Morrison denominated the master narrative, what Martin Luther King denominated the lie when it comes to Black women. That narrative is that Black women are less valuable. Black women's bodies exist for punishment. And again, those are narratives that emanate all the way back. They're derivative of slave narratives. And we never took any step in this country to dismantle those narratives. During Reconstruction, after Reconstruction, throughout the 20th century, there was no truth and reconciliation process. There was no re-education process to really interrogate, unpack, deconstruct, and dismantle those narratives. So those narratives are still strong and virulent, just as strong and virulent as they were during slavery, frankly. They have slightly morphed. It is impolitic to say that someone is inferior. And so now it has morphed to, oh, this person is a threat. Oh, this person is not competent. Oh, this person is disrespectful, because you can no longer say that that person is inferior, right? Because it's impolitic. But those same narratives, those same threads that have debased and destabilized Black women for generations are still alive and strong and having an impact on outcomes within our healthcare system and every other system, frankly. So the bottom line is that we need systemic institutional changes. We need narrative change. We need to undergo a process where we are transforming the American psyche as it relates to race. And we also need to take steps to develop our consciousness personally and in terms of our interpersonal interactions.
Do you think that, I mean, I think anybody would be lying to themselves if they said that the racism that this country has never, is all gone, right? Oh, we elected Obama, we're great, we're past racism, we're in post-racial. We all know that's a lie, I think. But do you think that people are aware that history that we have, that you just mentioned, the narratives that we have are leading to maternal mortality deaths, to infant mortality at this point?
Well, number one, I gave you the statistics already. And so when you look at those statistics, there's no other explanation for them. There's no other explanation for why a newborn baby that's not even a minute old is 3 to 4 times more likely to die if it's Black, that the newborn is Black. All right. What has that newborn done? You can't blame it unless you're going to say that Black people are fundamentally, biologically inferior. There's nothing that you can blame on that newborn. So what are we talking about? Where's that statistic coming from? And I told you that this is not about socioeconomics, because it crosses socioeconomic lines. It doesn't matter whether you have a PhD or no D. This is what you are dealing with as a Black woman or mother of a Black child within our healthcare system. And it runs the gamut through our healthcare system. Black women are 2 times more likely to die from ovarian and uterine cancer. So it's not just isolated to pregnancy and birthing mothers. These are statistics that we see across our healthcare system. One of the things that EJS has done, we diagnose the problem. We do a lot of analytics around implicit bias, and we work with social scientists to figure out how do we isolate the bias and how do we minimize it, because it's after the social science shows that after age, I think 5th grade or age 10, you can't eliminate the bias. It's far too embedded and ingrained and entrenched in our psyche to actually eliminate it. But it's kind of like high blood pressure. You may not be able to eliminate it, but you can manage and you can control it. So we we push for policy changes at the state and national level to help people, especially in the healthcare profession and in the legal profession, manage their bias so that it's not affecting their day-to-day decision-making and the patients and the clients that they care for. So one of the things that we were able to do in the state of California is that we were able to get the state of California to pass a spate of anti-bias laws specifically for all healthcare workers and all judges in the state of California. So all doctors, PAs, nurses, under this law, the anti-bias law, they have to take implicit bias, counter bias, and implicit bias elimination courses, starting from the time that they are in medical school. Another critical statistic that we found, which is one of the reasons why we pushed for this law, is that medical students in medical school, students are 40% of students believe that Black people feel less pain and that it is biological, right? And 25% of physicians and attendings, people who have graduated from medical school, believe that Black people feel less pain, even though there is no biological basis or evidence for that belief. And what does that translate to? It translates to statistics that show, for instance, that Black children who present with terrible stomach pain due to appendicitis or emerging appendicitis are 80% less likely to receive opiates and opiate care than their white counterparts. Black people are much less likely to receive palliative care, right? And one of the reasons why we saw the opiate crisis move through white society was because white people are so much more likely to receive opiates. Black people are perceived immediately within our healthcare with a great deal of skepticism and with this underlying racist belief that Black people do not feel pain. Right. And that's why I say our bodies are perceived as being meant to be punished. That emanates directly from slavery. And so these beliefs, these implicit biases that doctors are bringing to the table, they're mostly implicit. Like I said, they are heroes, but they are also human. These implicit biases are having a huge impact on Black people day to day, interacting with our healthcare system, and it's a devastating impact. We're talking about children not being able to get opiates when they're in terrible pain. We're talking about newborns dying at incredible rates. And so something has to be done. Something has to be done, and it's really important for there to be a public education campaign so people know about the numbers, and they know about the data and the statistics. And that, I believe, when you see these horrific, horrifying impacts that systemic, institutional, and personal bias are having on people, you have to be motivated to change and to make the investment that it takes to actually change systems.
It's absolutely heartbreaking when you hear some of these statistics. You hear about the idea that a child cannot receive the care that they need simply because of the color of their skin, for something that appendicitis. I mean, we all know what that is, and we know that it is ridiculously painful, that it's agony. When you talk about something that needs to be done, there's the work that you're doing. At what point do we need to see our elected officials step in? And I know that there has been some. Our current Vice President, Kamala Harris, had been part of the Momnibus and the Black Maternal Health Caucus before she ascended to the White House. So we know that there are some in Congress at our federal level who are trying to address some of these disparities that are affecting Black people every single day. But is there something more that we should be demanding of our elected officials? And should we be demanding it at the federal level, or looking more toward, like you were saying, with our local leaders?
Well, that's the perfect segue to talk about the work that I'm engaged in and that I've been engaged in over the last several years. This is the California Task Force to study and develop reparations proposals for African Americans. This is the Book of Truth. That's what I call it. It is the laws, a blueprint for reparations laws that we actually handed over to the governor and to the legislators in the state of California to begin the process of repairing the harm of 250 years of slavery, 100 years of Jim Crow, and decades of post-civil rights apartheid against African Americans. And so this repairing the harm, this reparations process, is the systematic process that we are using to do public education of this types of data of continuing disparities and harm, and also to push laws through the legislature that relate to reparations, specifically rehabilitating each and every one of our systems, which are frankly doing a disservice to Black people by design. We must rehabilitate, reimagine, and retool each and every one of these systems, including our healthcare system, so that they now center and serve the needs of Black people. And we are using this reparations framework, thought and action paradigm to address these abominable statistics and to change our systems.
And it's amazing. I remember when the task force was first called together, and then just this year, just this year, having the recommendations go to the vote and calling for, and I remember covering it, and there's so much in there in all of these different sections where it's not just about, oh, let's just, as many people think, we're just paying money to random people here. It's no, these are the specific harms, and healthcare, our health is one of those harms that has been done, as you mentioned, since slavery. How at this point is it, and I know the statistics, as you mentioned, they speak for themselves, but we know there are still those out there who are trying to deny racism exists, trying to argue that we talk too much about race, that we blame everything on race. How do we encourage people to see the truth and to say, no, this really is happening, and this is why we need to address it?
I think you have to just appeal to people's fundamental democratic values. United we stand, divided we fall. Until we address America's original sins of the genocide of Native Americans and African Americans, we will continue to be divided, right? And if we want to have a multicultural, inclusive, flourishing democracy, we must first address those tears in the fabric of our democracy that emanate from genocide, right? And so that is one of the reasons why we have brought forth this reparations framework for uniting our democracy and making it much more sustainable through this process of repairing the harm, repairing our systems, rehabilitating, retooling, and reimagining our systems so that they begin to serve, and when necessary, due to so much past harm, center Black people.
Lisa, I do want to be conscious of your time. So just two more questions. One of them is a bit heavy. With the maternal mortality crisis that we are seeing and how it is affecting Black women, I have heard stories in my own coverage of women who have expressed concerns about getting pregnant. We see even famous people. We saw Serena Williams, the struggles that she went through when she was pregnant. And there are some women who have expressed concerns about, I don't know if I want to get pregnant because I'm scared. What words, if any, could you or Equal Justice Society give to Black birthing people at this moment as they're trying to determine whether or not they can, not whether they should, but whether they can have a family?
Yeah, these issues are real. We see how devastating the statistics are. We see how real and palpable the danger is. It's not going too far to say that within our healthcare system, Black women and their offspring are in danger of extinction, which is one of the reasons why EJS publishes a health equity newsletter to advise Black women and all people, especially women in general and Black women in particular, about these statistics, about the threats and the dangers within our healthcare system, and about methods for advocating for yourself effectively within our healthcare system. So that is a newsletter that EJS publishes monthly to give women updates on this critical information that will allow them to advocate for themselves in our healthcare system. It's the reason why in the reparations task force proposals, we presented 115 proposals to the legislature in California as the blueprint for passing reparations that will be embedded in the rule of law in California. And within our healthcare system, one of the main proposals is to ensure that all Black women have access to doula services in the birthing room and for several months prior to their delivery date. And what's critical to know about that is I've told you the statistics for both Black women and Black newborns, right? So what's critical to know about that from a legal perspective, and given all the work that we did in terms of researching this, it is this data is comprehensive, it is evidence-based, and it is irrefutable. So when we say that Black women must have a doula, that the state has a compelling interest to ensure that Black women and their newborn babies survive the birthing process, since they're 3 to 4 times more likely to die than anyone else, that shows that the state has a compelling interest in investing and intervening. And it's not something that it should do, that we're like, well, is there the money to do it? It must do it. You know, under the 13th Amendment, our governors, our legislators are required to intervene to prevent what are called badges and incidents of slavery. You understand? So the 13th Amendment abolished slavery in the first clause, but the second clause that no one pays any attention to mandates that the legislature take steps to ensure and to preclude the continuing harms of slavery. It is not optional. Actually, the Constitution Amendment says Congress shall. Doesn't say Congress may, Congress can, Congress should think about it. It says Congress shall take measures to ensure, to eliminate the badges and incidents of slavery. That's what the 13th Amendment says. And so there is a duty. And so we must hold our legislators accountable to that duty. We must educate the public about the statistics, the data that shows the continuing harm that began during slavery, that began during segregation, and continues to today. And there's a direct through line between those different temporal stages. We must educate the public so that about the data and about the mandate that is embedded in our Constitution, so that they hold their legislators, their governors, their president accountable to that mandate that's embedded in our Constitution, and intervene to prevent the harm, to ensure that it ceases and desists, and that it never happens again.
Looking at that and seeing the more, and again, not enough attention finally being placed on our healthcare system, on the crisis that Black birthing people are facing at this moment in time. We know that, again, we have some of our elected officials working with the Momnibus, the Black Maternal Health Caucus. Do you see, in grassroots organizations, do you see our maternal health crisis, particularly in this country, ending, or at least some of these disparities lessening soon?
They will only abate if the public is educated, if these become mainstream conversations, and if we have a framework available and an infrastructure available to start to implement the policy changes. And that's one of the reasons why I feel very committed to the work of reparations, the work of repairing the harm, and the work of creating a framework and a blueprint for repairing the harm that we literally hand to the legislature, all neatly packaged. That's one of the reasons why I'm so committed to this work of reparations, because it can be done. It requires political will, it requires public education, and it requires holding our government accountable to the people. That's called
Well,
democracy.
I feel that we are very lucky to have your voice pushing for these changes, for your leadership. And so I thank you so much for taking time to talk with me today. I really appreciate it. I that was my last question for you. And so again, just thank you so much for your time today, Lisa.
Yeah, no, it's a pleasure, Cheyanne.